Hi, everyone. I want to address the scenario number 5, which is where a staff member early in the morning had witnessed a teacher walking down the hallway very erratically. And this particular staff member was just heading out to be able to board a bus in order to go and pick up a child that had significant disabilities. And so she was one of the adults that rode on the bus. So she didn't have time to be able to follow up with the teacher, and so called. And I happened to be in the office early that morning. I was looking for substitutes, calling in for substitutes, and so had been at the office. And we were about maybe 15 minutes, 10 to 15 minutes before the first bus run of students would be arriving, and other teachers and staff members would be arriving for 7 o'clock. We had a 7:30 time frame where every adult would need to be in the building, but students would start arriving from buses at 7. So I received the call. The staff member was obviously concerned, had spoken to the teacher, and the teacher was not very coherent at all. So I had no idea what was happening, but I knew there could be a medical emergency that was occurring. I, crossed my mind about, was this person having a stroke? Was there some other kind of medical situation that was happening, or was it substance related or medication related? So I ran up a couple of flights of stairs and went into the teacher's room, and she was face down on her desk. And so I, called her name and, sort of shook her shoulders a little bit, and she raised her head, and I could tell, unfortunately, that by her breath, that she had been using substances, not necessarily that morning, but probably pretty heavily through the night. And so I immediately trying to think about, like, do we need medical help? Is there something else going on? And so I said, and I was also concerned that students were going to start arriving, and I wanted to get her out of the classroom and certainly down out of that top story floor before it became a much more public, obvious situation. So I asked her if she was able to walk with my support, as there was nobody else in the building at that point. And I was really concerned about just, getting her to a private place and then being able to further assess where we were at. And, and I asked if she needed medical attention, and she said no. So I was able to get her down to my office before students arrived, just barely, within a minute or two, and busloads of students started arriving. And so I got her in my office, asked if I could get her support, said, she didn't need to speak to me. And I'm trying to remember all the policies that I'm, have been trained on around what do you do if somebody is under the influence, or there are concerns about that and they have arrived at school. So I knew enough that I didn't want to interrogate her about, about substance use, and wanted to make sure that she knew that she didn't have to divulge information to me without support from, association member there, or being able to have some sort of legal support or that kind of thing. My number one concern was her well-being and safety, since I had been able to remove her from her classroom. She wasn't a homeroom teacher, so she didn't have students that were immediately there. And so then my next order of business was to be able to find coverage for first period. So I had about 45 or 15 minutes to be able to do that. So as soon as the administrative assistant came in, I just was able to step out of my office and get her involved without talking about why, just that, you know, the teacher was not feeling well, was going to need to leave and go home. So asked the administrative assistant to find coverage for that classroom for the day, because I knew it was going to at least be needed for the day. And then was again able to, you know, check in. I had a call into the superintendent, who I was unable to get a hold of unfortunately for a few hours, but the co-principal that I was working with was able to get hold of him, and he arrived pretty shortly, and then we were able to come up with a plan, and that included being able to get her safely to her home. And it was an interaction between prescription medication that she was on for a mental health situation and alcohol. And so being able to, couldn't force her to, wasn't that sort of risen to the level of being able to force an ambulance or force her to medical attention, but obviously I couldn't let her drive. And it was a rural community, again, a number of years ago, you know, sending her by taxi or by an Uber or Lyft was not a possibility. So I drove her myself and waited with her in her apartment to make sure that she was going to be okay. She had recently moved to our community to start this new job and had nobody even in state that was living, that was nearby. So was able to help her be able to reach out and call her medical professional, be able to get her in to see a medical professional, and then be able to start the process of making sure that she was safe and taken care of. And then being able to think about what were our, next steps. And that really became consultation with the co-principal and the superintendent, and being able to say, okay, well, we can hold off on that until we make sure that she's in a good place and has support from the association, and and it is in a much better place to be able to have that conversation. So a couple of things with that is that I would encourage you to, there's a lot going on in these situations where you know that you don't, if students are not already in the building and if other faculty is not in the building, then part of my concern is making sure that there's not drama and chaos for the rest of the day. And then I'm also helping to protect the privacy and the dignity of my staff and faculty. So that meant that I can't just casually show up or ignore it, and say, well, I'm just going to give them a chance because I want to embarrass them, because it could have easily been a 911 situation. And so you cannot ever take that liability piece or that responsibility lightly. And I think there's a lot to weigh in this situation about what you need to attend to, but certainly the safety and well-being of staff and faculty, and then sort of the running of the school and that privacy, those privacy pieces, and then next steps, really understanding what are your policies, what are the supports, because really in policy, I could have insisted on calling the police. I could have insisted on calling for an ambulance to arrive, to be able to handle that situation. And in retrospect, that was probably some of the safest options to take. But for me, I was really concerned about, the dignity, well-being, and of the staff member. So a whole lot to think about with regards to a situation like this. And so I just encourage you to make sure that you plan for these emergencies that you have. Okay, so what am I going to do if I encounter a situation such as this? What will be the steps? So to be able to talk through that is really important. I'll just be honest with you, I'd considered lots of scenarios, but this was not one of them that I had considered. And so, you're moving on your instincts and your knowledge at that point, because time is your enemy. Time is not your friend in this particular kind of situation. So make sure you check your policies and make sure you have some planning around what to do in situations like this. Thank you.